video, I'm going to cover the physical therapy exercises that follow after you have trigger finger surgery. So the first exercise is going to go something like this. Grab the base of the finger that you just had the surgery on, and then go ahead and you bend your finger at that first knuckle bend, just like this. You'll do that 10 repetitions, and then what you'll do is you'll move up on the finger and you'll just get the fingertip there. And you'll do that again 10 repetitions. Do this 3 times a day. The next exercise you want to do is probably lay your hand on a flat surface, and then you're going to grab the tip of the finger and you're going to stretch it, and you should feel that tendon stretching right where you had your surgery incision at. So you just stretch that out and hold it for about 10 to 15 seconds, then let it rest for a little bit, and then do it again. Do that about 5 times, and you'll do that 3 times a day. The next exercise you're going to want to do is you'll start out with your hand straight open. You'll bend at that first knuckle, kind of like you're hanging on to something by your fingertips, and then you'll close it into a fist. Then you're going to open it again, kind of like you're hanging on by your fingertips, and then straight. And you'll just keep doing this. You're going to want to do that about 10 repetitions, again 3 times a day. And the last one is just pretty basic, and it's just opening and closing the hand from a fist to straight open. Again, 10 repetitions, 3 times a day. Now you're going to want to do this for about 3 to 4 weeks. Some people take a little longer, but you're going to want to do it until you feel like your hand is back to normal, just to work out and get that range of motion back. So those are the exercises that you're going to want to do for physical therapy following your trigger finger surgery.